A good husbandry and animal care program on a dairy is essential to the health of the cattle. One of the foundations for animal care is to prevent or minimize pain, injury, and disease. Disease is prevented by adherence to herd health, nutrition, and management programs that enhance well-being. The first step in proper animal health is developing a written herd health plan, developed in consultation with the herd veterinarian, to prevent common diseases or conditions such as mastitis, lameness, metritis, metabolic diseases, displaced abomasum, pneumonia, and infectious diarrhea. The written herd health plan includes a veterinarian client-patient relationship, vaccination protocols, daily observation of all cattle for injury or signs of disease, protocols for newborn calf management, protocols for painful procedures, protocols for cattle that develop disease or are injured, protocols for dystocia, protocols for prevention, detection, and action for common diseases and parasite and pest control, protocols for fly control, protocols for non-ambulatory animal management, protocols for euthanasia, protocols to ensure food safety, training programs for animal caretakers involved in detecting disease and injury, which include recording the cases and actions to be taken. The herd health plan is reviewed and updated annually. When it comes to newborns and milk-fed dairy calves, the dairy has a written herd health plan, developed in consultation with the herd veterinarian, which includes specific areas pertaining to newborn animals. Topics in the plan relevant to newborn animals include colostrum management, navel dipping, identification and record keeping, and protocols for vaccination, dehorning, supernumerary teat removal, castration, tail docking, and euthanasia. Navels are dipped in an effective antiseptic solution as soon as possible. Dip navels in disinfectant as soon as possible after birth. If the umbilical cord is not severed immediately after birth, it may be tied 2 to 3 inches from the calf's body. Wet cords are entry points for pathogens into the calf's body. An effective prevention treatment is to dip the navel repeatedly into an effective antiseptic solution. Certain painful medical procedures are necessary to ensure the safety of the workers and the animals on the farm. They include disbudding and dehorning, castration, branding, extra teat removal, and tail docking.
It's working fine, udder's fine, grooming's working fine.
A best practice is for dairy farmers to work with their veterinarian to develop a standard operating procedure that works best for the individual farm while providing appropriate relief from stress and pain to the animal. In addition, any animal caretaker responsible for performing the procedure receives adequate training. Under dairy farm best practices, calves are disbudded at 8 weeks of age or earlier and with appropriate use of analgesics and/or anesthetics. Disbudding and dehorning are performed for the safety of cattle and their caregivers. All other planned medical procedures are performed at the earliest age possible and with appropriate use of the analgesics and/or anesthetics. The National Dairy Farm Animal Care Program opposes the routine tail docking of dairy animals, except in the case of traumatic injury to an animal. This practice is recommended to be phased out by 2022. Current scientific literature indicates that routine tail docking provides no benefit to the animal or quality of the milk. At times, euthanasia for a newborn may be necessary to humanely deal with complications from birth or other conditions. Euthanasia is consistent with the recommendations from the American Association of Bovine Practitioners and the American Veterinary Medical Association.
You see the cow way over there with her ribs out.
One of the key components of the farm program is the animal observations recorded during the second-party evaluation. Viewing the animals is the best way to evaluate outcomes from animal care practices on the farm. Second-party evaluators are trained to score animals in 4 areas: hygiene, locomotion, body condition, and body lesions. The guidelines are 90% or more of all animals in all pens score 2 or less on the NDFP hygiene scorecard, where 1 is clean and 4 is dirty. Proper sanitation and waste management keep animals dry, clean, and free of manure and provide them with comfortable surroundings. The goals of sanitation for animal facilities are to minimize animal disease through clean facilities, minimize generation of odors and dust, minimize pests and parasites, minimize spread of pathogens. Basic sanitation practices include keeping the interiors, corridors, and storage spaces of animal facilities clean and emptying waste containers. Facilities are free of standing water, excess manure, unnecessary farm items, and clutter. Feed and bedding is clean and dry, even in areas with minimal housing and rainfall. Animal caretakers maintain a level of cleanliness to minimize the spread of pathogens. Manure is removed regularly from facilities and free stalls, and walkways are clean and have good traction. In best practice, all lying areas are clean and groomed. 95% of the lactating and dry dairy herd scores a 2 or less on the NDFP Locomotion Scorecard, where 1 is sound, 2 is moderately lame, and 3 is severely lame. The dairy farmer is taking action to improve animals with severe lameness, and a lameness prevention protocol is in place. Lameness, caused by painful lesions to the limb or foot, seriously compromises well-being and is a management priority for the dairy herd. Lameness may be reduced by preventive hoof trimming performed to both balance the weight bearing between the claws and restore a more upright foot angle, and by surveillance for lame cows coupled with prompt, effective treatment. Currently, the only objective method to evaluate the prevalence of lameness within a herd is the use of locomotion scoring. The farm program uses a convenient 3-point system that provides more consistency. 99% of all classes of animals score a body condition score of 2 or more on the NDFP Body Condition Score scorecard, where 1 is thin and 5 is fat. The dairy farmer is taking action to improve animals with body condition scores less than 2. Body condition scoring for dairy cattle is an important management tool for optimizing milk production and reproductive efficiency, while reducing the incidence of metabolic and other peripartum diseases. 95% or more of lactating and dry dairy herds score a 2 or less on the NDFP hock and knee lesion scorecard, where 1 is no hair loss or swelling, 2 is some hair loss and no swelling, and 3 is severe swelling and/or abrasion through hide. Hock and knee lesions are an important indication of inadequate bedding and lack of animal comfort. Dairy farms with a higher prevalence of hock and knee lesions also tend to have a higher number of lame cows. A healthy hock and knee is free from hair loss and swelling. The incidence of hock and knee lesions is reduced with adequate bedding and proper stall design. Under best practice, cattle are housed in environments that prevent injury. Often the location of a given injury can provide insight into where the problem lies. For example, obvious swelling on the neck can be caused by inappropriate feeder design, where the overhead rail traumatizes the tissue and causes severe swelling. By monitoring the location and prevalence of these injuries across the entire herd, management will be able to identify and address specific problems in consultation with their veterinarian. Pest control is part of a herd health program because vermin transmit diseases and interfere with the animal's comfort. Under best practice, dairy farmers adopt procedures to control flies, mosquitoes, lice, mites, ticks, grubs, fleas, rodents, skunks, and pest birds.